Assalamu alaikum everyone. This is Zainul Abidin, Director at IEEE CTSoc UET Taxila, signing in as your host today. I, on the behalf of IEEE CTSoc UET Taxila, welcome you all to this amazing session on October Talk Breast Cancer. For today's webinar, we are honored to have Miss Sobhiya Basala on board as our guest speaker. Our guest speaker, Miss Sobhiya Basala, has master's degree in cell and molecular biology from the Lebanese American University. Her research focused on the targeted therapy against breast cancer cells. During her time in Dr. George's lab, she honed her skills in breast cancer research, mastering cell culture techniques on breast cancer cell lines. Her journey continues in Dr. Abi Habib's lab, where he made groundbreaking strides by becoming the first globally to explore dual selection anthrax lethal toxin therapy in breast cancer models. This pioneering work opens new possibilities for targeted cancer cell therapies, and we are excited to learn from her unique insights. Thank you so much, ma'am, for honoring us with your presence. Just a little housekeeping before we proceed. It will be a 40 to 45-minute session, and the last 20 minutes are reserved for queries. If you have any query, you can unmute your mic and ask directly from the speaker, or you can just type in the chat box. I will bring them to you in the end of the session. With that, I once again welcome you all, and now I will hand over the screen to our worthy guest speaker. Over to you, ma'am.
Hello, everyone, and thank you for having me today. It's a great honor to be invited and welcomed to give you an awareness on breast cancer, especially that it's October, the month where everyone around the globe is sharing the word about this disease and encouraging and supporting one another against the fight. Welcome again to today's webinar on breast cancer. My name is Sobhiya Basala. I'm an associate researcher at the Lebanese American University. I am a cell and molecular biologist, and my research focuses mainly on breast cancer targeted therapy. Without further ado, let's take a look on today's outline. Okay, it's not working. Okay. So starting with today's awareness, we're going to have a small background information about what cancer is in general and what breast cancer is in specific. I'm going to share with you some statistics that highlight the burden and the impact of this disease. We're going to move to breast cancer risk factors, symptoms, and the importance of breast self-examination. Later, we're going to discuss the screening methods for this disease, the types of breast cancer, of course, and the stages. Moving to treatment, we're going to talk about briefly the standard treatments at hand and the targeted therapy that has been gaining importance nowadays. Last but not least, we're going to have a section about general information or general knowledge because it matters to know what's true and what's not true about this disease. And finally, a conclusion where I'm going to call to action and, of course, leave a small window to your questions. Let's start with the background information. What is cancer actually? Cancer, simply defining it, is actually the uncontrolled growth of abnormal cells inside the body. Inside the body, we have a normal physiological process called cell proliferation or cell growth. The body needs this physiological normal process because it's always in consistent need to new cells in order to either repair damaged tissues or replace damaged cells. However, unfortunately, sometimes this process breaks down and abnormal or damaged cells tend to grow in an uncontrolled way and they multiply to give a mass also known as a tumor. So what is breast cancer? It is the disease of uncontrolled growth of these abnormal cells, however, inside the breast. The breast anatomy is made up of different components. We have the lobules, the ducts, the nipples, the fat tissue, and the muscle tissue. The main two types of breast cancer that occur are either lobular carcinoma or ductal carcinoma. The lobular carcinoma is where breast cancer starts in the lobules, which are the glands that produce the milk inside the breast. And the ductal carcinoma, on the other hand, is the breast cancer that happens inside the ducts, which are the tubes that transport the milk from the lobules to the nipple. Now, both types of breast cancer, whether lobular carcinoma or ductal carcinoma, can either be further defined as benign or malignant. It's very important to differentiate between the two terms. What is a benign tumor or what is a malignant tumor? A benign tumor is a tumor that initiates inside the ducts or the lobules, and it remains inside the place of its initiation. So you see here the abnormal cells in this figure below are remaining or are they started in the ducts and they remain inside the ducts. Now, 80% of the tumors that are screened are classified to be benign. They are highly treatable and they are linked to high survival rates. However, if these abnormal cells tend to continue to grow uncontrolled, they tend to be invasive as they break the membrane barrier and they reach the blood vessels where they metastasize. In other words, they travel to the nearby blood vessel, and from the blood they go to distant organs, affecting and invading distant organs such as the brain, the liver, the lung, and the spleen. Now that we have a basic knowledge about what cancer is and what breast cancer is, let's highlight some of the statistics to show the burden and the impact of the disease, especially in Pakistan. Now, Pakistan is a country that is considered to have the highest rates of breast cancer compared to any other Asian country. And this is the reason, and the reason behind this is actually the lack of awareness. Also in Pakistan, 1 in 9 women is going to develop the disease throughout her lifetime. In Pakistan, also annually or yearly, we have 90K thousands of breast cancer cases, 40K thousands of the 90K are going to die. Around the world, whenever 138 women is being or is going to be diagnosed with breast cancer, there is on the other hand 1 man is going to suffer with the disease. So from the statistics, we find that it's not only a gender-oriented disease, it also affects men, however, to a lower extent. Let's delve into what breast cancer in risk factors. Now, the main question that scientists and doctors are asked is, what is the main reason for why breast cancer happens? Or what is the reason why 1 woman is going to struggle with the disease compared to other women who's not going to have this disease in her lifetime? Now, the answer to this question is actually scientists and doctors did not find a specific reason. However, they associate this disease to specific risk factors. The risk factors for this disease can be categorized as either manageable, the things that we have control over in order to control our probability to be developing the disease, and non-manageable ones. They are the risk factors that we cannot control. And whether or not they're going to predispose us to having the disease. Starting with the manageable risk factors, we're talking about the diet. The diet is a very important risk factor. A diet that is based on saturated fats, carbohydrates, sugars, and unhealthy fat is a diet that predisposes the individual of the risk of developing the disease, and vice versa. A healthy diet lessens the probability of that individual of acquiring the disease. We're talking about alcohol consumption and tobacco consumption. Alcohol and tobacco consumptions are linked to increased rates of breast cancer. Exercise is also one of the important risk factors to lessen the probability of having the disease. A sedentary lifestyle is a lifestyle linked to developing the disease, and a fit person or a healthy person is a person who has a lower probability of developing breast cancer. The last manageable risk factor is oral contraceptive pills, or what we call birth control pills. Now, these pills are prescribed to women and girls to either regulate their period or to prevent pregnancy. One research shows that oral contraceptive pills being taken on a span of 6 months has an increased rate of of developing the disease. Another research shows that having oral contraceptive 3 years in a row has double and triple the probability of that woman to develop breast cancer. Moving to the non-manageable risk factors, we are talking about hereditary issues. We're talking about genetic mutations that we cannot control. They come with our DNA and the moment we are born. We're talking about here, in this case, genetic mutations in genes such as BRCA1 and BRCA2. They are associated with high cases of breast cancer. Also, we're talking about age because this disease, the elder the person becomes, the more the person is at risk of developing the disease, especially women who are 40 years and elder. We're talking about family history, especially if the girl or the woman has a first degree relative. A girl who has her mom diagnosed with breast cancer is a girl that is at a higher risk to develop the disease compared to a girl whose mom is normal. The last non-manageable is gender. We know that breast cancer affects women a lot compared to men. However, this does not mean men are not at the risk, and we saw statistics that proves the statement. Now we move to a very important slide. It's the symptoms associated with disease, with this disease. I'd like you to keep it in mind because later we're going to discuss the breast self-examination. You need to know these symptoms and to keep them in mind. This disease is associated with different symptoms. Some of the symptoms may occur together, and sometimes they occur alone on their own. Some of the symptoms are nipple discharge, especially if the discharge is blood. We have lumping or thickening of the breast tissue or the armpit tissue. We have symptoms such as the armpit pain and the breast tissue pain, a visible lump, whether in the breast or the armpit, skin irritation, changes in how the nipple looks. We're talking about inversion or retraction of the nipple. And also in very rare cases, we have a symptoms that is called the orange peel-like skin. It occurs on the breast tissue and it's sometimes indicative of breast cancer. This leads us to breast self-examination. This method is called an early self-detection method. It can be done at home. You can do it on your own at home before taking a bath, or you can go to a clinic and do it with a physical health care practitioner. The steps are similar, whether at home or at a clinic. The woman has to do it once per month, basically 2 to 3 days after her period, and a man can do it anytime once per month. It is through visual inspection, where you're going to stand in front of a mirror and you're going to sense your breasts and your armpits with your palm gently, either up and down movement or a circular movement, depending on what suits you best. And the purpose behind this is to look for any changes in the breasts or the armpits, especially looking for the symptoms that we talked about earlier. And if any symptoms found, you need to report directly to a healthcare physician. Now, awareness is meant to equip you with knowledge and not scare you. The symptoms should not scare you if found. Do not directly think that you have breast cancer. It simply might be a change inside your body, a temporary change, especially when we talk about the woman's body, because the woman's body is always changing with hormonal changes, pregnancy, giving birth, menopause, and period. However, if any symptoms, if you saw any symptom, of course, you need to report to a healthcare physician. This leaves us with a diagnosis of breast cancer. The golden standard for screening for this disease is a mammograph or a mammography. It's highly encouraged for women at the age of 25 to 40 to go for a mammography once every 3 years as a preventative method or an early detection method, because the earlier you detect the disease, the higher the survival rates and the better the treatment outcome. Women at the age of 40 and above, they are required and highly encouraged to do a mammography once every single year. Now, how mammography works, it's actually made up of two plates. The breast tissue will be made between the two plates, and a slight pressure is going to be applied. The result is a low dosage of an X-ray picture, as you can see below. In this case, the patient has breast cancer because a lump was detected. It is noteworthy to mention that sometimes a mammography, although it is very effective, sometimes it can give a false negative result. Why is that? Because the volume of the breast and the density of the breast plays a key role in determining the accuracy and the precision of the result. The bigger the breast, the bigger the volume and the density, the lower the accuracy and the precision of the result. A false negative result is when a woman has the result saying that she does not have breast cancer. However, in real life, she is having a breast cancer, but the mammography did not detect it due to her dense breast tissue. Let's move to types of breast cancer. Now, in science and in literature, also doctors, they classify breast cancer in 100 different ways. Here is a simple way to differentiate between the types of breast cancer. You can classify them as either non-invasive or invasive. Non-invasive, the ones we talked about, the ductal carcinoma in situ or the ductal carcinoma, the lobular carcinoma in situ or the lobular carcinoma, they are the same names. The non-invasive breast cancer is a tumor that started and remained confined to the place of initiation. For example, the ducts, if it's ductal carcinoma, and the lobules, if it's lobular carcinoma. It did not spread to surrounding tissues. The survival rates are very optimistic when it comes to non-invasive breast cancer, and also the treatment successes are considered to be very effective when we treat non-invasive. Moving to the invasive breast cancer, we have also ductal carcinoma or invasive lobular carcinoma. Here, the cancer has spread to nearby tissues, and sometimes, in the most cases, the cancer has attacked distant organs such as the brain, the lung, the spleen, and the liver. One critical type of breast cancer is called the triple negative. It is called so because it lacks the receptors to three hormones. There are the estrogen, the progesterone, and the HER2. Triple negative breast cancer is one of the hardest breast cancers to treat. It is very hard to deal with because it is very aggressive and very invasive, and it invades organs in a very short amount of time. A second type of invasive breast cancer, yet it's a very rare type, is called the inflammatory. It's very aggressive, very hard to treat. The survival rates associated with this type are very low, and it has its own symptoms, such as the breasts appear to be very red in color and swollen. When we talk about stages of any disease or stages of cancer or breast cancer, the staging of the disease is very important because it gives us insight on what's going on inside the body, the course of the treatment that the doctor is going to prescribe, the survival rate that we must expect, and of course, to what extent did the cancer spread inside the body, and what is the best treatment and survival outcome. We're talking about breast cancer. It is usually classified into four stages. Stage zero is the cancer still confined to the ducts or to the lobules. It's highly treatable with a survival rate that reaches 100%. It's very optimistic. And usually, stage zero is detected when a person goes for the breast self examination and mammography as a preventative method or an early detection method. Moving to stage one breast cancer, we're talking about a tumor that is small in size. It's almost 2 centimeters, may or may have not spread. In certain cases, the stage one breast cancer might have spread to nearby tissues, not distant ones, nearby tissues in the chest or the armpit. And in other cases, it may have not spread, but it is 2 centimeters in size. The survival rate decreases in this stage to 98%, which is still considered to be a very good as a survival rate when we talk about breast cancer. Moving to stage two, we're talking about a larger tumor. It is bigger than 2 centimeters. In this case, it has a spread to nearby lymph nodes, especially those inside the armpit. And we're talking about a survival rate that is still optimistic, 93%. Now, moving to the more critical stages, the stage three, the cancer has spread to nearby tissues such as the chest wall and the skin, and to more lymph nodes, not only those in the armpits, but in this case, the cancer still did not metastasize. It still did not invade distant organs such as the liver, the lungs, and the brain. The survival rate decreases up to 72%, but it's still manageable and still treatable. The problem comes when a patient is diagnosed with stage 4 breast cancer. It is called a metastatic stage where the cancer has taken all over the body. We're talking about invasion to the bones, to the liver, to the lungs, to the brain, almost everywhere. And the survival rate, unfortunately, is only 28%. This leaves us with the treatment of breast cancer. We have the standard treatment that has been there for decades and has shown effectiveness in containing the disease. We're talking about surgery, chemotherapy, radiation therapy. Surgery, when it comes to breast cancer, we have two types, the lumpectomy and the mastectomy. Lumpectomy is when the doctor removes the tumor itself from the breast, and sometimes may or may he not remove certain lymph nodes in the armpits, especially if he suspects whether or not he suspects the cancer has spread to those lymph nodes or not. So it's only about removing the tumor, sometimes lymph nodes and sometimes not. The mastectomy, it's a bigger surgery. We're talking about the tissues that are removed. It is highly impactful to the patient because the entire breast tissue is removed, not only the tumor, and also the entire lymph nodes are removed because here in this case the tumor is bigger in size and unfortunately has spread to the surrounding tissue and to the surrounding lymph nodes in the armpits. Chemotherapy, I know you have heard about it. Chemotherapy is also an effective method when it comes to treating cancer and breast cancer in specific. However, the problem with chemotherapy is that it lacks selectivity, which means that it targets normal cells as well as cancer cells. So it does not only kill cancer cells, but also it kills normal cells, leading to a deterioration of the overall health of a patient. Chemotherapy. Chemotherapy usually is given before a surgery, especially if the doctor wants the tumor to be smaller in size so that he does not remove a lot of breast tissue. Also, it's given after, it's also given after a surgery in order, especially if the doctor suspects that the cancer has escaped and traveled and affected nearby tissues. So he gives chemotherapy after a surgery to kill any cancer left. The third standard treatment is the radiation therapy. This is a very specific type of therapy, usually given to stage 4 breast cancer, to the metastatic stage. Also, it's given after a breast surgery is done. The radiation therapy is usually kills cancer by the means of using ionizing radiation, and it kills the cancer by damaging the cancer's cell DNA. Now, although these treatments have been there for decades, although they have shown effectiveness, however, they have side effects that outweigh their benefits. And the drawbacks for some drawbacks for these treatments are the following: 20 to 70% of patients relapse within 5 years. What does this mean is that 20 to 70% of all the patients diagnosed with breast cancer are going to have recurrent breast cancer after 5 years or within 5 years of treatment. The second drawback is that the 5-year survival rate is only 28% when we talk about metastatic or stage 4 breast cancer. This means that after 5 years of treatment, only 28% of the patients will be alive or will survive, which is a very pessimistic, a very survival rate that is not usually benefiting patients when it comes to metastatic breast cancer. And that is why researchers are going towards a different route when it comes to the treatment. Also, chemotherapy results in drug-resistant cancer cells and systemic toxicity because chemotherapy, we said that it's not selective. It kills cancer cells, but it also kills normal cells. And in the majority of breast cancer cases, the doctor tends to increase the concentration of chemotherapy because cancer cells tend to be resistant to the therapy, causing systemic toxicity. This leaves us with a new route of therapy that is called the targeted therapy of cancer and breast cancer. It's a type of cancer treatment that specifically targets molecules or pathways involved in the survival and the growth of cancer cells. It is by the targeted release of certain drugs made inside the lab that are targeted towards the site of the disease while sparing normal ones. So it affects cancer cells effectively without harming normal ones compared to chemotherapy. The drugs used in targeted therapy can be monoclonal antibodies made in the lab, small molecule inhibitors, or bacterial toxins. Now, on a span of 2 years and a half, I have been working on a bacterial toxin called anthrax toxin. In history, it's a very harmful substance, and it was used as a biowarfare. They used to do wars with this substance to kill animals, cattle, and human beings. Recently, it has been gaining importance because it showed a potential to cure or to treat cancer effectively without harming normal ones. It was first tested on melanoma and blood cancer leukemia, and it showed high effectiveness in targeting the cancer cells without doing any harm to normal ones. So it attacks cancer cells without harming healthy ones. It is produced by gram-positive bacteria called Bacillus anthracis. Scientists found it and they extracted it and modified it in a way that it attacks cancer cells without normal ones because they found through research it attacks the MAPK pathway present in cancer cells. The MAPK pathway is an essential pathway for normal and cancer cells to survive because it allows cell proliferation and differentiation, and this pathway has been found to be dysregulated in a variety of human cancers, especially breast cancer. Why anthrax toxin is being very selective because the modified version of it allows the drug to go through the blood to search for cancer cells, and once a cancer cell is found, the drug attaches on the receptors that are cancer specific and not normal specific. Once it attaches on the receptor, it gets activated, it gets internalized inside the cancer cells, it cleaves the MAPK pathway that we talked about, eventually leading to the death of the cancer cell. Also, the same case applies to normal cells. The drug will go through the blood. It will reach a normal cell. However, it will not sit on the receptors on the normal cells because they are not the required receptors. By this, it does not harm any normal cells. This leaves us with the myth about breast cancer. It's important to know what's true and what's not true, what isn't true that is being spread about the disease. Growing up, I used to think bras with underwire can cause breast cancer, but there isn't any research that supports this statement. So bras are not actually linked to causing breast cancer, especially the underwire ones. However, it is encouraged for a woman to remove her bra before sleeping just to enhance the circulation of the blood in that area. Another myth, and we also saw that it's not true. Men do not get breast cancer, it only affects women. We saw that in every 138 women to be diagnosed. On the other side, there is one man struggling with the disease. A recent myth is that a mammogram can cause breast cancer or spread it. It's very recent research. It's a very recent research, but then it was denied because the only thought behind this research was that if a woman patient having breast cancer, went to do a mammogram, the pressure that is applied in the mammography can spread the cancer in case it was there. But later, this statement was rendered as a myth. No research is supporting actually this statement. Facts about breast cancer. On average, in the United States, every 2 minutes, a woman is diagnosed with the disease. And talking about the United States, it's the breast cancer is the second leading cause of death of women in that country. Another fact that is nowadays uh, making the labs around the world go crazy is breastfeeding because it lowers the risk of developing breast cancer. Now, how it does so, it's still being researched. It's still being to be known. However, it is a fact that breastfeeding lowers the risk, and doctors and scientists encourage women who just gave birth to breastfeed her baby 1.5 years up to 2 years in a row. The last fact is that only 5 to 10% of breast cancers are tied to family history, which is a good news actually that 90 to 95% of the cases, we are the ones responsible for it by our diet, by our health, and by our lifestyles in general. This brings us to the last part of today's awareness. From this slide, I would like to call to action because the best protection is early detection, whether you choose early detection by the method that is breast
Sorry for the
self-examination.
disturbance. There is an
Yeah, sure.
announcement. We have a link for the e-certificate in the chat box, which is open for only 10 minutes. You can fill that.
Okay.
Thank you.
The best protection is early detection, whether you go for early detection by the breast examination method at home or at a clinic, or you go, of course, for a mammography each 3 years if you're 25 to 40 years old, and of course, encourage your family members and your loved ones, if the woman is 40 years and above, to go every year for a mammography. I would like finally to share with you this quote that I believe is true. The only person who can save you is you. And I leave, of course, the ground for your questions. Thank you for having me. I'm ready for your questions.
Thank you so much, ma'am, for such an informative session. Now we will moving towards our question answer session. If you have any question, you can raise your hand.
Assalamu alaikum, ma'am. Thank you so much for this beautiful session. Ma'am, please brief us more about your research regarding this.
Okay, so my research is actually about breast cancer targeted therapy. We talked about anthrax toxin that is recently known for its and research for its potential to target cancer cells without harming normal ones. What I did in the lab actually is take this toxin that is purified and extracted prior of in time, and I took it to test it on a different panels of breast cancer. We had the MDA-MB, that is the triple negative. It is one of the invasive, the most detrimental and fatal types of breast cancer. And we found out that within a certain concentration of anthrax toxin, it is being able to significantly decrease the triple negative breast cancer without harming normal ones. However, this research is called in vitro. It's not in vivo. In vitro, it means it's cell culture. The cells are outside the body and I'm dealing with them. And later, it should be taken to a second step, that is the in vivo, where we test the same concept in mice. And later, it's going to go for clinical trials. Of course, certain people are going to sign reports and disclosures that they are willing to participate in our research. And later, we're going to go further based on the results that are we going to take, whether to actually make it as a medicine or not.
Thank you so much, ma'am.
Welcome.
Uh, if you have any questions, you can just raise your hand.
Okay, thank you so much, Miss Sobhiya, for this insightful presentation. Can you please name one best method for early detection of breast cancer?
Okay, so a not very precise but an effective breast cancer examination method is the one that we talked about, the self breast examination, where you can do it at home or at a clinic with a doctor, where you're going to look for lumps. It's usually done by sight, so it's by vision. You look for any changes that you think happened recently, whether your armpit tissue or your breast tissue, and you report it to the doctor. If you're not comfortable doing this, or you find it that's not very precise, if you are 25 of age, or from 25 to 40 years of age, you are highly encouraged to go for a mammography. It's not very painful, it's just a bit uncomfortable, but it gives a very precise result, especially if the breast tissue is not very big or dense. But it's highly precise, and usually it detects breast cancer as early as stage 0 and 1, which are correlated with high success of treatment and high survival rates. And also another methods, if you do not want to go for a mammography for whatever reason that you have, you can go for breast ultrasound. It's also effective, or MRI, which is a magnetic resonance imaging. It's also a method that detects cancer as early as stage 0.
I would like to invite our chairperson of IEEE CTSoc to share his thoughts about the session.
Yeah, of course.
Hello, am I audible?
Yeah, you are.
Okay, thank you so much, ma'am, Sobhiya, for coming here and sharing all your research with us. Because, as you know, it has always been a huge taboo in our society to talk about such issues. And I think for now, there are many participants that might want to ask some questions, but they might be facing some hesitation due to the, general society
Yeah, of
taboos.
course.
So I will surely share your LinkedIn with them so they can reach out to you through your LinkedIn or any other type of contact you would like to share with us. And huge thank you to everyone else who joined us here today for the vision of sharing awareness about this very important issue. And I would also like to say that the boys who joined this session, huge thanks to you and shout out to you guys, because this is not just a gender-based issue. This is a social issue in our society. And as Ma'am Sobhiya said, that this is a rising problem in Pakistan and more than any other country in Asia. So we need
True,
to
that's
get
true.
Yes, so we need to get together in this, and we should raise awareness about this problem, because you might be a brother to someone, you might be a father or husband or a son to someone, and you might need this information in your future, and you should know about these things for your own family and your own future as well. So thank you so much to everyone who became a part of this awareness session, and I hope all of you will like to do such awareness in your family and in your friends, and keep doing good work. And thank you, ma'am, once again. Thank you to Isha for organizing this session. Thank you to Zan. And I hope everyone had a good time learning a lot about this problem. Allah Hafiz.
Thank you so much for having me. It was very glad. I was very glad to see that some men really joined our awareness. It is really good news. Thank you so much for having me. I had a great time.
I think there
It
is
was
a
our pleasure,
question
ma'am.
from someone.
Yeah, sure.
Yes, Muzammil, you can ask.
Assalamu alaikum. Thanks for the very informative lecture. I want to ask that the chemo is given to which stage of cancer?
Okay, so chemotherapy is it depends on the case of the patient. If the tumor is very big, usually it's given before the surgery to in order to shrink the size so that the doctor doesn't go and removes the entire breast. And also it can be given after the surgery has been done, especially if the doctor suspects that some cancer cells have escaped and are present in a surrounding tissue, such as the chest wall or the skin or the armpit. And also, chemotherapy can be given in later stages, such as stage 3 and stage 4, because when we talked about these stages, actually, and unfortunately, these stages, the cancer has taken all over the body, and the only standard treatment. So when we talk about standard treatment, the only treatment there is either radiation or chemotherapy. And also it depends on the country, because not every country has radiation therapy, or also it depends on the patient and their budget, because the therapy, whether radiation or chemo or surgery, it also depends on how much the patient is ready or can pay. So every patient has their own tailored course of treatment based on their the stage, the background, the size of the tumor, and their budget.
Thank you, ma'am.
Welcome.
So now we are done with the queries. It's time to wrap up this amazing webinar. Thank you so much, ma'am, for honoring us with your presence. Your knowledge has really uplifted the bar. I would like to thank all the attendees for becoming the part of this session. Hope you guys learned a lot from the event. Stay blessed, stay positive, take care, Allah Hafiz.
Thank you so much. Allah Hafiz.
Welcome.